Hi guys, I am here with another question from past papers of MOH, DHA and HAAD. This is very important question because this is a real life emergency situation. In this situation, your decision about the management will be life saving. Okay, let's read the question first, then we will discuss. This question says a 69-year-old male presented in emergency department with epigastric pain. He's suffering from, he's referred from primary care with an ECG showing ST elevation and T wave inversion in some leads. He is in shock and pale. While shifting him to bed, you found a cigarette pack in his pocket. So he's a smoker. On examination, upper abdomen is tender on palpation and you are feeling a pulsatile mass. Which of the following steps in the management can be life-saving for him? Aspirin and thrombolysis, outer cardiac enzymes, call to cardiologist, arrange shifting patient to cath lab, and last option is IV fluids, call to surgeon and arrange urgent surgery. So, as you have already diagnosed, this is a scenario of ruptured aortic aneurysm because there is pulsatile tender mass in epigastrium and patient is in shock. Unfortunately, when we see ST elevation, we usually think only about MI, myocardial infarction. Uh, Thinking about myocardial infarction is not wrong, but this should not be your only diagnosis. Okay, there are other situations, and this is one of the example where there is ST elevation in ECG, and that is not myocardial infarction. Okay, as this is ruptured aortic aneurysm, you can't thrombolyze or give aspirin to the patient. You can well imagine the consequence. Second option is order cardiac enzymes. Is it life saving? No. You can do cardiac enzyme test in your further management plan, but this is not an acute step to do to save the life. Okay, call to cardiologist and send the patient to cath lab. Half of this is correct. You will involve cardiologist, but not as first step. And many times this ruptured aortic aneurysm can be associated with acute coronary syndrome, but you can't shift the patient with ruptured aortic aneurysm to cath lab. Okay, you have what you have to do is pass two large bore cannulas, IV cannulas, give him a push of IV fluids and arrange 5 to 6 packs of blood and call the surgeon, involve the surgeon immediately and arrange the surgery. Okay, arrange urgent surgery. Symptomatic aortic aneurysm is indication of urgent surgery, and this is ruptured, so it's you can say more urgent. Okay, let's briefly discuss the causes of ST elevation. Okay, here are some causes of ST elevation. We will briefly discuss all these topics. Acute myocardial infarction, as you know, first you will think about acute myocardial infarction. This will be due to the blockage in coronary arteries, and patient can present with central chest pain radiating to left arm, but there are some atypical presentations, and there can be epigastric pain in especially inferior wall MI, but there will be not a pulsatile palpable mass which is tender. So you will think about acute coronary syndrome or acute myocardial infarction with ST elevation, but not in this scenario. Second is Prinzmetal angina or coronary vasospasm. This is also called variant angina. As the name shows, there is vasospasm of coronary arteries, and it can present at rest, and it is sometimes transient. It is usually transient ST elevation, and it responds well to nitrates. Then there is pericarditis. Pericardium is outermost fibrous sac of heart. Inflammation of it is called pericarditis. There will be sharp, sudden onset chest pain, and it will increase on lying down and deep breathing, and it will decrease, not relieve, it will decrease on sitting. Okay. Next one is benign early repolarization. It is present in almost 1% of the patient with chest pain. This is believed to be a normal variant. Okay. In this, there will be ST elevation and J point elevation. What is J point? J point is the point where QRS meets ST segment. Okay. Next one is left bundle branch block. As you know, this is electrical conduction abnormality. There is blockage in left bundle branch, so the left ventricle will contract later than right one. Left ventricular hypertrophy, as the name shows, it is hypertrophy of left ventricle. There are many causes of it, like hypertension, aortic stenosis, and it has certain criteria of diagnosis on ECG other than ST elevation. We will discuss it in some MCQ. Ventricular aneurysm. It is one of complication of myocardial infarction, ventricular aneurysm. There is a dilatation or bulging of some part of ventricle, and it presents as persistent ST elevation. Okay. Brugada syndrome, it is a genetic disorder, and it is there is problem in electrical pathway usually, and so its presenting features are ventricular arrhythmias and sudden death. It is one of causes of sudden cardiac death syndromes. Ventricular paced rhythms. This is about pacemaker. When you insert a pacemaker, according to the placement of wire, there are certain changes in ECGs, and when it is placed in right ventricle, there will be features of somewhat similar to left bundle branch block. Okay. Raised intracranial pressure, as name shows, it is increased pressure in cranium. It is due to the blockage of CSF or increased production of CSF. This is a medical emergency, may be associated with various conditions like aneurysm, stroke, and infective brain disorders, a long list. Acute cardiomyopathy. If I am pronouncing it wrong, kindly forget, because this is a Japanese word. This is also called a broken heart syndrome. It is associated with emotional background, like if a mother listens news of her child death or sudden loss of job, emotional disturbances that lead to this condition. Okay, so this is well called a broken heart syndrome. And at the last, there is aortic aneurysm. Aortic aneurysm we have discussed already in previous MCQ and other MCQ. I will not go in details. So these are common causes of ST elevation. Take home message is ST elevation is not always MI, and always remember that you are a problem solver, you are a healer, you are a lifesaver. Okay, so for life saving, you must know the emergency conditions and how to respond. Okay, so after this take home message, if you have not subscribed the channel, click the button and see you in next video. Bye bye.